To explore the Zika outbreak a little more in depth, I was joined earlier by Dr. Isaac Bogach. He's a staff physician and assistant professor at the University of Toronto, the divisions of internal medicine and infectious diseases. I first asked him about what may be causing the outbreak of Zika, given that it was first discovered in the late 1940s.
It was first discovered in the late 1940s in Uganda, and it was thought to be found only in parts of Africa and Asia up until the middle part of the 2000s. There was an outbreak on a few islands in the South Pacific in the middle part of the 2000s, and then it was introduced into Brazil probably around 2014, with the first cases really being detected in 2015. This is pretty interesting because it really demonstrates how interconnected our world really is. For it to be introduced to Brazil, it just took likely an individual who was infected with this virus to travel to the Americas and land. And people have the virus in their blood only for a few days, but that's all it took, because this person was bitten by a mosquito likely, and then that mosquito took up the virus and bit other people. So the cycle of transmission was started in the Americas. But it really does reflect just how interconnected the world really is.
Now, I'm glad you brought up the sexual component of Zika, and we'll get to that a little bit later here. But I wanted to ask you that since Zika virus is exactly just that, it's a virus according to the CDC, but the Centers for Disease Control say that there's still a whole lot that they don't know about this virus, such as the transmission through sex. So what does this mean for the millions of people who live in these afflicted areas? Does it change, dating or mating habits, sex? Talk to me about that.
Sure. So, I mean, I think the key thing to remember is that although there are multiple modes of transmission of this virus that we're learning about over the last few weeks and months, the main mode of transmission is going to be through mosquito bites. That is how this virus is going to spread and how this virus is going to be transmitted in the vast majority of cases. And of the who knows how many, hundreds of thousands, maybe a couple of million cases that are that have been recorded or thought to have occurred over the last couple of months, the vast majority of these are from mosquito bites. Now, there's been one recorded sexual transmission of this infection during this current outbreak, and two prior recorded sexual transmissions of this infection in past outbreaks. So, we still have to take this seriously. I mean, even though there's only been 3 documented cases to date, we still have to take it seriously as a mode of transmission. And in fact, various public health agencies, such as the Centers for Disease Control in the United States, England's public health agency, Canada's public health agency, have started to come out with interim guidelines on using condoms, for example, if people are returning from an area that's affected with Zika virus and their partner is pregnant or considering becoming pregnant. So we're starting to see these recommendations emerge for travelers as we learn more about this virus, and we learn that it's not just going to be mosquito transmitted, but there are other potential modes of transmission.
Okay, so it sounds like we should maybe perhaps treat this a little bit like an STD at this point until we know more information. But let's talk about the microcephaly and the innocent babies that are being the most affected by the Zika virus. How does this virus affect the child maybe in utero? Are they maybe in pain, or is there pain accompanying the birth defects as well?
So the first point is that we still don't have what we call a causal association between infection during pregnancy and birth defects. And what I mean by that is we can't say A causes B. Infection during pregnancy causes birth defects. We can't say that yet. We certainly have arrows that are pointing in that direction, but the science has not proven a direct correlation, a direct association between one and the other. And of course, you can be sure that this is a very active area of research now, because quite frankly, if it wasn't for that potential association, this outbreak would not be as big a deal as it is. The vast majority of people won't have symptoms. The people that do have symptoms that get infected will have typically a very mild course. So if it wasn't for this potential association between infection during pregnancy and birth defects, this would not be nearly as big a deal as we are seeing.